Today I will be talking about reproductive cancers. Specifically, I'll be talking of prostate, testicular, ovarian, and cervical cancers. So cancer forms when healthy cells in the organ change, therefore abnormal cells are released, forming a cancerous or benign tumor. Before I started this research, the only thing I knew of this non-infectious disease was that it was deadly and that cancerous, also known as malignant, was the worst type of the two tumors. In order to expand my knowledge, I chose this topic. So to start off with, prostate cancer is a type of cancer found in the prostate of a male body. Normally, prostate cancers do not spread to other parts of the body quickly. Here I have an animation showing the stages that are found in a typical patient's history of this cancer. So in stage 1, it tends to be a slow-growing cancer, tends to be hard to detect as the cancer cells are differentiated and the PSA levels are low. Stage 2, tumors found, visibly seen in the prostate, and the PSA levels are low. In stage 3, PSA levels increase and the PSA levels either remain low or increase to a medium rate. In the last stage, stage 4, the cancer spreads beyond the prostate, and what we'll see in the later animations are that this is a common theme among these type of cancers. So the symptoms seen in a patient aren't normally found in the early stages. The only way this type of cancer can be detected is through a PSA or DRE test. And usually patients will experience symptoms such as frequent urination and a weak flow of urine. They will notice blood in their urine or seminal fluid, and also they will feel discomfort when sitting down due to an enlarged prostate. These are just more of the typical type of symptoms. I won't be going into the others because it's more of a repetitive theme that we'll see throughout. Moving on to the testicular cancer, this is a type of cancer that begins in the germ cells, in which the cells that are seen in the testicles that produce immature sperm. Although the cause is unknown, we do know how this cancer begins. So here I have an animation of the 3 different stages. So in stage 1, which shows low risk, cancer is at a T level in the testicle. In stage 2, which is known as the high risk, cancer has spread to the retroperitoneal lymph nodes. And in stage 3, the cancer is spread to the lymph nodes and or the other organs. Some symptoms that this type of patient may experience would include lumps on their testicles and pain or numbness in their testicle or scrotum. And moving on to the ovarian cancer. So this is a cancer in which also, just like the testicular cancer, the cause is unknown. However, we do know that it's abnormal growth of cells in the ovaries. So this cancer has 4 stages. Before the ovarian cancer, you can see it's a healthy ovary, no problems, a good, healthy patient. Usually this type of cancer develops in the later ages of a female's lifetime, and in the first stage, they will notice that the cancer is confined to the ovaries or the fallopian tubes, and then proceeding on to stage 2, the cancer starts to spread to nearby organs in the pelvis. In stage 3, it's just stage 2 on steroids, in which the spreading will increase from the ovaries eventually to the lymph nodes. And then lastly, in stage 4, the advanced stage in which cancer has metastasized beyond ovaries, and it will reach over to the fallopian tubes as well. Some symptoms this type of patient may experience include bloating or swelling in the abdomen. They will experience weight loss, discomfort in the pelvis area. They'll notice changes in their bowel movement, and they'll also notice frequent urination, trips to the bathroom. Lastly, I'll be talking of cervical cancer, which is a sexually transmitted virus called human papillomavirus, also known as HPV, which causes the cells of the cervix to grow abnormally, leading to this cancer. So this type of cancer actually tends to be located on the cervix. There are 2 types. The 2 main types actually would be the squamous cell carcinoma or the adenocarcinoma. Usually the squamous cell carcinoma makes up 80 to 90% of the cervical cancer, while the adenocarcinoma makes up 10 to 20% of the cancer. Some of the symptoms that this type of patient may experience include spotting blood between their periods, bleeding after their menopause, and bleeding or pain during any sexual intercourse. Some treatments that have been found for these types of cancers include radiation therapy, in which beams of ray can be aimed towards cancer to eliminate it, or through the use of Brezhnev therapy, in which radioactive seeds are inserted around the source of cancer. Also, intensity modulated radiation therapy and proton therapy have been known to be a type of radiation therapy to successfully remove this type of cancer. Another route to go would be surgery, which is usually left as the last option. In this, they will use a radical prostatectomy, in which they will remove the pelvic lymph nodes in a male or female. They will also do a laparoscopic prostatectomy, or they'll do a bilateral orchiectomy. Other ways to go would be the focal therapies, in which this is more of a clinical test going on at the moment. What they do is pretty much this is a less invasive method that would freeze the cells in order to treat cancer. Another way to treat cancer would be the androgen deprivation therapy, and lastly, chemotherapy. So some currently trending news would be more focusing on not the cures of cancer, however, making treatment for cancers more of an easier pathway. So what they've done recently is they are trying to test some genomic tests. They're conducting those as of now in order to help the patients. In addition to that, they are trying to create shorter radiation therapy in order to decrease the exposure of radiation that these patients must face in order to get their treatment. The last trending news are the artificial ovaries, in which these ovaries are being created in order to help fertility in patients with ovarian cancer in order to give them a chance at pregnancy. Now, this is a pretty cool topic. If you are interested, I definitely would recommend checking it out. It's pretty interesting. Anyways, thank you for tuning in, and hopefully you've learned a bit more about reproductive cancers than you knew before you watched this video. Thank you.